And so business is allowed to do this. We give business affordability tax credits, and in fact, we continue to move forward on this. And to move right to the end, the surcharge for the top 1.2% of the income bracket is a surcharge that applies only to people making $350,000 a year or more. Effectively, only 0.8% of the people in Rhode Island. This is the very same population that got the benefit of the Bush tax credits. This surcharge is going to account for less than what is going to have been the benefits that they received under the tax cuts they got under Bush. And frankly, a small price to pay for achieving the moral obligation that our country has to be able to give everybody the dignity. This is ultimately it. The dignity of treating people like human beings. Like human beings. I mean, imagine your life is on the line and people don't look at you as anything other than a product. Somebody that is valued based upon what they see as your monetary value, not as your human value, your monetary value. In a materialistic society. Shouldn't materialistic society stop at the door of the value of your health and your ability to live? I can't tell you how, insulting it is when I have a friend of mine call me from an emergency room. They're waiting in line for a terrible pain or something to get examined, and they can't get seen. They have to call me to come down to see them so they can actually get seen by a doctor, because they know if I show up, there'll be more attention given to them. How outrageous it is that you have to know somebody in order to get treated. How outrageous. Imagine if you're not somebody of any means and you're in a hospital waiting to be treated and someone of more means comes in. You're more important than me? I think that's morally outrageous. And that's the country we live in right now. And to those of you who are in the field of healthcare delivery, I just want to say to those of you, you are special people. And in this bill, we do more to incentivize primary care and the work that you do to provide for those people in our society that need health care. And those of you who have asked about me and my family in light of my dad's illness, let me just tell you, I couldn't have had a more profound appreciation than today for the work that hospice care nurses do. I am absolutely indebted to what they have done to not only have helped my father, but to have helped my family. And what a difference they made in the quality of life of my father in his remaining year of life. To be able to give him the dignity and love that they gave him. It was a vocation for them. To help him live a quality life during his remaining year on this earth. And I will tell you, when it ultimately comes down to it, it's about family. It's about the ability to make sure your loved one is treated with dignity. And it's about making sure that we can live with a peace of mind and security that we don't have to have two tragedies. One, an illness, and the other tragedy, worrying about whether we're going to pay for that illness. So I thank you for allowing me to be here, and we look forward to answering the questions that come about. Thank you.
Thank you, Congressman Kennedy. I think the Congressman has just demonstrated that along with being one of the hardest working members of the Congress, who starts the day with us today and ends it in Washington receiving an award in honor of his father, but he's also conversant with this whole huge issue we're all grappling with. AARP has long been a leader in the field of healthcare reform, starting at our very beginning. And this is a great organization of some 40 million members, and Congressman, a lot of them are pretty lively specimens. Here in Rhode Island, we have 138,000, I think is the number we're at the moment. But we depend on our volunteers for the work that AARP does. Our staff is small, and let me just introduce the remaining member, who is Rochelle, and I think Rochelle's out at the desk there. She was in the room before. Rochelle Jennings, who keeps us all in order and solvent. And beyond that, our volunteers carry the ball for us all the time.